Hello everyone and welcome to your Medicare Monday newsletter. In today's video I kind of just wanted to talk a little bit about Medicare and price transparency, also sites that you can visit to get these types of transparencies, and also this book that I found that I think would be very helpful for everyone who is simply on the US government's or US systems, health systems, medical insurance. Let's get into it. Okay, so the book I'm talking about is called Never Pay the First Bill. It's written by Marshall Allen, who is an investigative reporter. He writes things about the medical system. He also has a blog. You can go check that out if you wanted to. It's some really neat resources that I'll be going into more of in the future, probably just adding it to my blog, not really posting too much about it in this newsletter, but it will be available. You know, my resources are never charged. Just you can go ahead and visit my blog. It's going to be either at understandmymedicare.org or matthewragudo.com, and I'll probably have a link for both of those in both my emails and on the YouTube videos, so check them out when you got time. Alright, so price transparency and how much things cost. So Medicare has a website called Price Procedure Lookup. I'll leave this in the link below, and you can find out about how much something will cost nationally and on average. And unfortunately, they don't tell you every single item. They mostly focus on big procedural surgeries and how much it would cost. So here's the site here. Let's go take a look. So like I said, you can't look up like 99215 or 99212. These are the procedure codes to go to a doctor's office. They don't tell you what they are. Instead, they have more, I guess you could call it, advanced type surgeries and procedures on here. So let's go with like some kind of extraction. Ooh. So cataract surgery, if you have this done at the ambulatory surgical center, you would pay $361. If you had this at the outpatient hospital department, you'd pay $573, and that's the price that you would pay if you did not have a Medicare supplement plan. The retail cost of this, as you can see as I expanded it, the doctor's fee is $746 and the facility fee is $1,000. So Medicare would pay of this $1,445. You would be responsible for $361, and this is provided that you've already paid your Part B annual deductible. Of course, if you have a Medicare supplement, depending on the plan letter, you may be responsible for some or most of this cost. And then here's the hospital. Hospital is going to be more expensive because the facility fee, as you can see here, is going to be higher. That's kind of something that you kind of need to be aware of. And also, you need to be aware of, because everything's more expensive at a hospital or a facility, lab, anything that's inside of a hospital or hospital affiliated structure. For example, this is going to be kind of for more price transparency and figuring out where you should get your care done. I had labs done. Lab work, they took lipids and a general metabolic profile. My general metabolic profile was $211. They discounted it to, I believe, like $110, and so I paid my copay, which is 30%, about $30 for this, $32 or so for this procedure. And when I looked up how much this procedure actually cost, if I had gone to a standalone, non-affiliated hospital, not affiliated to any hospital, just a standalone lab work area, this would have been, it said it would have been $3 to $10, but instead it was $110 because I had it done in the hospital. As you can see here, it's much higher, many times higher, rather than if I had done it at somewhere other than the hospital facility. So just a word of caution for those of you folks who do get services outside of the hospital, you know, make sure they're actually outside the hospital. Okay, so point number 2, I got my labs drawn at the clinic, which is part of the hospital. So therefore, they were able to charge me a hospital fee because I was technically inside the hospital, or at least an expansion of said hospital. So for those of you folks who are getting any kind of work done, when in all, if possible, do it at a standalone facility. It will save you money. And if you can see our second resource I'm going to talk about today, no, not clinical price check. I want to go to healthcare, Blue Book, and Fair Health Consumer. So these are two different websites, and we're going to go ahead and look at how much this procedure, it's 850 is the procedure code, 80050. So 80050 is lab, and I'm going to say where I am. We're going to search. Oh, it appears to have kicked me out. Okay. So if you want to go ahead and sign up for this website, it's completely free. I'll leave links for all this stuff in the description and of course in the email. So this is a general health panel. And general health panel at this Cedar Park area is about $101. And if you pay cash price, it might be less. The fair price is $69. That's taken between, kind of like the average of the two. And this price is based on employers' self-funded plan data. So there's two types of major insurance or major ways that consumers in America get their healthcare. One is through self-funded plans. Let's say you have a huge employer like Amazon or Apple, and I believe Amazon, Apple, and was it Microsoft? I know there's a few companies that self-insure, which means that they don't pay an insurance company to administer their benefits and pay for them. They have enough cash flow, enough assets where they instead will self-fund it themselves, and making their own kind of health plan. That's where this data comes from. This next website, fairhealthconsumer.org, is based off of what the insurance companies will pay or will reimburse for. So let's go ahead. I'm going through it kind of fast. If it is too fast, just go ahead and go back or put me on slow motion or something. So we're going to say we're staying in network because that's the intent. I'm going to again use my zip code just so we can keep things static. And I'm going to enter the CPT code. So 80050 is the CPT code that I used. I agree. General health panel, get my cost. So the in-network price, $27. That's about what I paid. My copay was $30 something. And here we go. So insertion of a needle into the vein to collect blood is $3. And the hospital outpatient procedure is $265, and then I got a discount. So that's pretty high, right? Considering that same procedure here is $70. This one's much higher. So let's see if we can compare prices. So the in-network price again is $27. Out-of-network uninsured price is $211. And there we go. That's kind of what the cost comparisons are outside and if you were to go out of network. So it does make a huge difference. And that's kind of where it's all over the place, right? And I can even show you what Medicare finds or what they charge, but it's gonna take some time. So if you want to see like the Medicare list, then you can email me and I'll just email you the entire file because it's not nice and pretty like this. It's an actual huge Excel spreadsheet with tens of thousands of procedure codes. So it is kind of I guess the prices do vary quite a bit. So make sure you are asking the right questions, and also you can ask what the cash price would be if you didn't have or if you decided not to use your insurance. And this is something that I just recently found out that may or may not be advantageous to you. So in Hawaii, or in many states, probably all the states, when you go to a provider and you have insurance, you're supposed to be able to use your insurance, and you are, number one, expected to use your insurance from your hospital, from your doctor. I talked about many episodes ago about Medicare Part D and how you can ask the pharmacy, or pharmacist, depending on who you're talking to at the pharmacy counter, can I pay via cash, or what's the cash price of this product? And you're not supposed, the pharmacists, even though they know that the cash price is less, they're not supposed to tell you. But you can ask. You can also do that for medical services. Each hospital now has to kind of provide a list or a menu of prices that they charge for cash paying customers. You can also, number two, ask for a discount. But some hospital providers, hospitals, billers, patient service representatives will say that if you have insurance, you might as well use it. That is partially true. So due to something called Hipaa, you can actually pay cash for healthcare instead of actually using your health insurance. And why would you do that? Well, many people who are not Medicare age, so this might not apply to you folks who are on Medicare, but it might, they have high deductible plans. And with high deductible plans, sometimes the insurance rate, the rate that insurance companies pay for services, the amount that you will have to pay for this service if you're using this insurance, is actually higher than what they would charge someone without insurance. Okay, so that's kind of doesn't make sense, right? If you're with part of an insurance company, shouldn't you have better price negotiation power because you are bringing more customers to this hospital? And that would be the case if the health industry was on the side of the patients, which unfortunately financially they are not. So what can you do then if you go to the hospital and you have this huge bill that you have to go through the deductible for? Well, in many cases, and in this case particularly, the author of that book I talked about in the early part of this video, he actually said, and through his investigative research, said that due to Hipaa, now the HIPAA, Hipaa, is the ability for you to protect your own health data. You can actually protect this health data from the insurance company and not let them know that you're getting this service done. So therefore, you are cutting out the health insurance from this particular transaction, and it allows you to negotiate a better rate for yourself potentially if the cash price is higher or lower than what the insurance would pay. And you can tell them you have this deductible, you're going to pay it anyway, you want the best price for yourself. That is your right. Okay, so that's kind of where, our 2 points today is, number one, figuring out how much things cost, and then number two, negotiating a price, because the insurance company is one that fixes these prices. You can find the fair value to get a ballpark of what you might be charged, but what if that ballpark price is outrageous, right? You can then use your own discretion and cash price and figure out if the hospital is willing to quote unquote play ball with you. And that's what I'm going to just throw out there to you folks. I talk a lot about how the system is wasting money. Insurance companies are preventing you from getting services, and the doctor is your best friend. But sometimes the hospital may not be in your best interest, because this is how, and this is, I promise to be quick. Hopefully you can kind of get it. I might draw things out for you folks, but put it this way. Okay, so you go to the hospital, you have to get a service done. Could be expensive. Let's just say it's not outrageously expensive and the insurance company is willing to pay for it, it's a $10,000 procedure. The insurance company is going to just say, okay, it's $10,000 procedure. Most people need it. This hospital has been doing it all the time. Hospital, we won't even audit you. We'll just say, if you push this claim through, we're going to say it's a preventative service. It's the, it's just one of those things that we know everyone needs. So go ahead and just do as many as you want. And then you think, wow, but that's great. I'm getting this service. Now the insurance company, well, yes, that's great for the patients. They're going to say, hey, you know what? We actually had way more people do this one service last year. So this year, we are going to raise premiums by, let's call it 10%. And they do this because, number one, the insurance company has lost money because more of their members have done this service. I'm not saying this service is wasteful or anything. It could be. The hospital could just be charging the insurance company for tons of these services, even though they're really unnecessary because the insurance company is not checking. And then the insurance company says, well, the doctors are happy, they're getting paid, the hospital's happy, the hospital's getting paid. We're happy because the insured, they're getting their services covered. But flip over to the following year when the insurance company has to raise premiums to cover the losses that they had last year. Who's really winning? Not the patient. So it's always important to limit the amount of medically unnecessary things that are going on, and also look for the best price that you can find if it is in, of course, your scope of doing. Sometimes we don't have that ability. We have to just entrust our health to the physicians and hope that they have the best care. All right. So what can you do about it? Well, I always try to figure out what you can do. So there's a couple things. You can go to the websites that I list out here. You can keep subscribed, keep listening, as I will push out more content that will actually be able to help, give you guys the tools to do things like this, to find better pricing. And number 3 is you can be healthier. I'm not saying that you guys are unhealthy who watch this. What I'm saying is you can do your best to heal yourself, to go through physical therapy perhaps for pain, to choose the non-pharmacological way, to choose the non-pharmacological therapy or treatment, there it is. And also choose to be healthier. You can go and get preventative things done, but seriously, many preventative procedures are like a 3-step process that end up spending more money. And ultimately, well, yes, it is important to get these screenings done early. It's forced on us. You can go to the Preventative Services Task Force. If that's not the right name, hopefully I have it in the description below. And those folks are not funded by people who make money off of these tests. So they would have a little bit better guidelines. They may be less stringent or less often to get these procedures, diagnostic procedures done, but it will save money on the entire system. And you might think, well, the system should pay for me, right? Okay, if that's the case, then you should be paying for it because you will be. You will be, because Medicare is funded by taxpayers' dollars. Health insurance from the Affordable Care Act, and even for small and large employers, are ultimately paid for by who? Either the taxpayers or the employees. Because if you are part of a group plan and you use up a lot of services, next year, guess what? Same situation as those people who used up those $10,000 services I talked about in the example. The insurance company says, hey, you know what, Mr. Employer, your group used up a lot of services, we're raking up those premiums, and then the employer's share goes up, the employee's share goes up, and maybe you don't get that raise, right? And you have to pay more for your healthcare premiums next year. So while yes, I believe that everyone should have a right to getting their healthcare, health insurance, it is drawing down on the entire system. So make sure, number 1, you're saving on your bills. Number 2, you're not getting unnecessary services. And number 3, you keep subscribed so that you can get up-to-date information, new information, resources, tools that you can actually use to help you stay healthy, be healthy, lower healthcare costs for everyone, because that's ultimately what we need to do, and have everybody be healthier. I hope you guys have a good rest of the week. Remember, do good things, stay tuned, be well, be healthy, and we'll see you in the next video.